ICU nurses can literally do morning CPR while eating a hamburger. Let's do makeup. Nothing phases them. And a nursing check. A good nursing story. 35 years of them, so that I won't forget. It comes to you from 1997. Years is that. I was working at the time as an ICU nurse. I was 27 years old, working on a neurosurgical trauma intensive care unit. Tell from the name of the unit, the type of patients that are there, the type of days that we would have. ICU nurses are very, very strong. If you weren't strong when you started working at an ICU, you definitely become strong. Not in body, but in mind and spirit. In the year, just because so long ago that I'm pretty sure almost all of the players in this are gone, now. I was the youngest person in the room. Here's this story from 25 years ago and remembers this experience, then I was the one sitting across the table from you. Needed to do a consult room chat with a family of a patient who was declared brain dead, to talk to the family about doing organ donation. Apparently the family had expressed that they were interested in organ donation. Set up this meeting. We called in the organ donation coordinator, trauma surgeon, my manager, myself. If you're not familiar with how it works when somebody is declared brain dead, their actual time of death is marked when an attending doctor signs that they have no brain flow to the brain. And so this particular patient's time of death was actually like 2 hours ago. It was like a long conference room. Family lined up on one side and the staff lined up on the other. Trauma surgeon who was coordinating the whole thing. To his left was the coordinator for the organ donation. I was the one sitting right next. I was like right-hand person to the trauma surgeon. Family had expressed doing organ donation. Ended up having probably a 40-minute meeting. Reviewed brain death and what that meant for their family member. ICU nurses see a lot of death, okay? So don't judge me for being callous about this. This is a unit that saw a trauma surgery area, sees a lot of death. The whole time we're in there is agreeing, they're like, yes, we think this is a great idea. How long is the process going to take? Conversation where the family has to sign the papers, and they signed the papers. And what organs would be donated, they signed the papers. As we're getting ready to leave the meeting, it was his grandma. I just remember it was an older female. Stopped everybody and then said, I just want to know, will he recognize us? What? And asked her to repeat it because none of us really thought, we didn't really understand what she said. And sure, you take out his brain and give him a new one. Do you think he'll recognize us? Or will he want to be with his other family? A surgeon actually said, I think we're practicing Frankenstein medicine. It's like, you're not giving him all these organs, you're taking them from. That's when the hysteria started. And screaming, PS's that they ripped up the contract. They did not donate all of his organs. That's nursing, 1997. Crazy.